and welcome to another episode of What's in My Body Today. Today we'll be talking about tuberculosis. What is it? It is a deadly disease caused by bacteria that are spread through the air from person to person. If not treated properly, tuberculosis disease can be fatal. Tuberculosis is a disease caused by a bacteria called Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but they can also damage other parts of the body. What is abnormal about tuberculosis, you may ask? Well, the lungs eventually form numerous cavities and bronchial erosions. Symptoms and signs that you may develop when you have TB are fatigue, loss of appetite, a cough that lasts more than 3 weeks, chest pain, coughing out blood or sputum, fever, or weight loss.
The TB skin test isn't perfect. Sometimes it suggests that people have TB when they really don't. A false positive test may happen if you've been vaccinated recently with the BCG vaccine. This tuberculosis vaccine is seldom used in the United States, but is widely used in countries with high TB infection rates. False negative results may occur in certain populations including children, older people, and people with AIDS.
Blood tests may be used to confirm or rule out latent or active tuberculosis. These tests use sophisticated technology to measure your immune system's reaction to TB bacteria. A blood test may be useful if you are at high risk of TB infection but have a negative response to the skin test.
Your doctor is likely to order an imaging test. This may show white spots in your lungs, where your immune system has walled off the TB bacteria, and reveal changes in your lungs caused by active tuberculosis.
Your doctor may take samples of your sputum, the mucus that comes up when you cough. The samples are tested for TB bacteria. How is this disorder treated? Medications are the cornerstones of tuberculosis treatment, but treating TB takes much longer than treating other types of bacterial infections. For active tuberculosis, you must take antibiotics for at least 6 to 9 months, depending on your age. Active tuberculosis, particularly if it's a drug-resistant strain, will require several drugs at once. Some types of TB are developing resistance to these medications as well.
Ethambutol is used with other medications to treat tuberculosis. Ethambutol is an antibiotic that works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for viral infections such as common cold or flu. Using antibiotics when it is not needed can cause it not to work for future infections. Pyrazinamide is used with other medications to treat TB. It is an antibiotic that works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. Bedaquiline is a medication used to treat tuberculosis. Specifically, it is used to treat multi-drug resistant tuberculosis along with medications for tuberculosis.
Ethambutol, pain in the joints or itchiness and rashes. Pyrazinamide, loss of appetite and nausea, although some people experience pain in the joints. Bedaquiline, abdominal or stomachal pain, chest pain, coughing, spitting blood, or yellow eyes.
Here is a patient that was submitted to an imaging testing. This testing resulting in positive TB. This picture demonstrates the stages of how tuberculosis spreads.
This picture shows how a very damaged lung with tuberculosis looks like. In comparison to the last picture, this is how a healthy lung should look like. Here is the Mycobacterium tuberculosis, which is the cause of TB.